What's up, guys? My name is Omarr, and today we're going to talk about Narcissistic Personality Disorder. So, what is Narcissistic Personality Disorder? According to the Mayo Clinic, Narcissistic Personality Disorder is a disorder that causes one to have an inflated sense of one's own self-importance, lack of empathy for others, and a need for admiration. It's also characterized by having a mask of ultra-confidence. And this ultra-confidence is a mask that covers up a very, very fragile self-esteem. And that self-esteem oftentimes is vulnerable to the slightest criticism, meaning that a person with this disorder has a hard time taking any type of criticism from anyone. So what are the signs and symptoms of narcissistic personality disorder? According to the DSM-5, narcissistic personality disorder is characterized by expecting to be recognized as superior without having the merits that warrant it, exaggerating your achievements or your talents, being preoccupied by fantasies of success and brilliance and achieving greatness, believing that you're special and that you can only be understood by other equally special people, requiring constant admiration, having a sense of entitlement, expecting special favors and wanting people to comply without question, having an inability or unwillingness to recognize the needs or feelings of others, being envious of others and believing others are envious of you, and behaving in an arrogant or haughty manner. So how may these symptoms manifest in real life? If you have narcissistic personality disorder, you may come across as conceited, boastful, or pretentious. You may have an attitude that tends to look down on or belittle people. You also may feel entitled to special treatment, and if you don't get that special treatment, you might become frustrated. If you have this disorder, you may also want the best of everything, meaning the best car, the best house, the best spouse, the best everything. Now, the need to have these things come from deeper feelings of insecurity. Furthermore, if you have narcissistic personality disorder, you may have a really, really hard time handling criticism. And if you have this disorder and you do get critiqued, you may react with rage or react in a way that belittles the person that critiqued you in order to make yourself feel better about the situation. That reaction to critique is secondary to the extreme low self-esteem one might have when they have narcissistic personality disorder. Now, there are no known causes of this rare disorder, but there are some things that may put you at risk for developing it. For one, in biologically vulnerable children, parenting styles that overemphasize how special the child is, but also criticize the child's fears or heavily criticize the child's failures may contribute to one developing this disorder. The thought behind this is that the child may try to hide their low self-esteem by developing this kind of fake mask of perfection. And in doing this, they also tend to have a need for admiration and a fear of any type of criticism that may come their way. Males are also at higher risk for developing this disorder, and it usually develops by early teens or early adulthood. Now, if this disorder is left untreated, some complications that can occur include depression, problems at school or work, drug and alcohol abuse, problems with your relationships, whether it's with your spouse or other friendships, and also suicidal thoughts and suicidal behavior. So, what do you do if you think you may have this disorder? The first thing that you do is you make an appointment with your doctor. Now, if you do have this disorder, there may be some difficulty here when it comes to making an appointment and actually going to the appointment, because setting a doctor's appointment to address some issues like this may present some problems because a person has to admit that they actually have some issues going on. And for a person with narcissistic personality disorder, it can be very difficult to kind of admit to oneself that something is actually going on, something may be wrong, because it kind of disturbs the whole self-concept of being perfect and being exalted up high and having something wrong with you in a sense can disturb that image of oneself and oftentimes may cause someone not to make that appointment to go see somebody. But if you do suspect that you may have this disorder, it's really important that you recognize that that's what's going on and try to make an appointment to go see somebody. And if you know somebody that may have this disorder, you suspect may have this disorder, you may want to help encourage them to see somebody so that they can get the help that they need. Now, when you go to your doctor, it's likely that they're going to refer you to a mental health professional, and they're going to do a psychological evaluation on you to determine whether or not you have the disorder. If you are diagnosed with this disorder, your treatment will likely be psychotherapy, also known as talk therapy. But it's important to note that personality disorders are not easily treated, and treatment may take several years. So it's really, really important that you stick with your treatment plan and take an active role in your care. That's all I have for today. If you have any questions or comments, please leave them in the box. If you enjoyed the video, please like, share, and subscribe. Again, my name is Omarr. Thank you for watching. Later, guys.